So this unit we're going to talk a little bit about health. And like so many other things in sociology, we first have to start going back to an idea about how we define that. What do we actually mean by that? And the first thing that I sort of need to sort of place in that is an understanding that from the outset, the way that we define health and the way that we study it in sociology is more than not being sick. So this is not about the absence of diseases or the absence of illness. It is about, the WHO sort of term is like a complete state of physical, social, and mental well-being. And that's a really high bar, which makes sense from the WHO because that's largely what they're trying to get people to aspire to. But you just need to understand that that piece is really, really important. And one of the reasons why we talk about the sociology of health and health being social is partially because of that piece that we sort of define social well-being as part of health, and that plays into things. We don't really start, the study of the sociology of health actually comes in a little bit later. So this is something that kind of emerges around the end of the Second World War. And it sort of changes partially because essentially the way that people were getting sick and getting injured and sort of experiencing morbidity and mortality was changing. So as you might gather, in the Second World War, lots of people died in combat, which is fine. I mean, from the perspective of like a sociology of health, like we can understand why that exists. But but when the war ended, people still got sick. We started to see more in terms of degenerative diseases. There was, for those of you who haven't sort of made that connection, I will make it for you. That post-war period, everyone, especially in North America and in Europe and sort of the Western world, had gone through, like the political establishment had gone through relatively recently, the sort of crushing reality of the Great Depression. And it was really important to politicians at the time to not go back to that, to not go back to this environment where so many people were suffering for a number of reasons, partially political instability, partially sort of general compassion, but both are true. And that is also sort of combined with like the growth in psychiatry. So the post-war era is where we sort of get the emergence of the diagnosis of post-traumatic stress disorder. There's a lot of emerging sort of research in that, which sort of is pointing to ideas that social experiences can lead to mental illnesses, and we sort of have to pay attention to those pieces. So part of that is, again, about that shift and the desire not to go back to sort of the eras of the Great Depression sort of led a lot of governments to sort of think about how they might intervene in terms of improving people's health and improving people's sort of sense of well-being. And that had a lot of factors in terms of cultivating and devoting resources to what we would now call the sociology of health and illness. I should also like highlight that in a lot of ways, that post-war era is a very odd one, just from sort of compared to other social environments historically in human history, largely because fewer young people died. So one of the things that is probably not something you've ever thought of in your own life and sort of your parents' lives is that for a large part of human history, it was quite common for up to a third of children to die before their 5th birthday, right? Like it was really, really difficult to be a young person for a number of reasons, right? We didn't have antibiotics, we didn't have great sort of healthcare systems, and even things like without antibiotics, if you get something so simple as like a bad cut and it gets infected, we don't have a way of treating that. So infant mortality was historically sort of like going way, 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 way back to like the 1800s and even earlier than that, very, very common. And in the post-war era, all of a sudden you had this sort of drop in infant mortality and sort of young people stopped dying, getting really, really ill, partially because the scientific sort of study had advanced to the point that we could deal with some of those issues. So we had antibiotics. right? And antibiotics can treat a variety of infections. We also have sort of some emerging understandings of things. So, for example, this is a Canadian invention that just sort of celebrated a century a little while ago, but the discovery of insulin after the discovery of insulin, it becomes possible to treat people with type 1 diabetes, so juvenile diabetes, and allow them to live more than a year or two after diagnosis, which used to be quite common. So there's that kind of piece where all of a sudden young people weren't dying as often, but people were still getting sick. There was sort of an increase in degenerative diseases, an increase in chronic conditions. And the sociology of health and illness kind of comes out of that discussion and a desire to understand that. In a contemporary context, it's worth noting, and many of you already know this from sort of your own lived experiences, that we're in an even an interesting time now in the sort of contemporary world, like the last 15, 20, 25 years sort of thing, partially because we're dealing with both, right? Historically, if you go back to the Middle Ages or what have you, a lot of that is people died because of communicable diseases. People died because of infections that we didn't know how to treat, as well as sort of from accidents that are now sort of preventable and treatable. And then sort of in that post-war period, the deaths due to infectious diseases and the deaths due to sort of accidents and public health issues kind of decreased. And then degenerative diseases and chronic conditions increased. But now we're in this space where we actually have both, right? We still have all of those degenerative conditions and all of those chronic illnesses, but we're also seeing the emergence of new infectious diseases. So you guys are very familiar, I imagine, with the idea of sort of the emergence of H1N1 and what that sort of does to a society. And part of the reason that COVID did create so much very rapid social change is that no one wanted to go back to the experience of the Spanish flu pandemic in 1918. We talk a lot about the flu pandemic of 1918. I suppose I shouldn't call it the Spanish flu pandemic, but that is how you'll see it referred to. And in that environment, you're talking about essentially 1 in 10 people sort of passing away. And at that point, everybody knew someone who had been impacted by that. And the memory of that is a really important part of sort of how we responded to the COVID pandemic, because that was really bad and no one wanted to go back to that. And it was really bad from a sort of social perspective. Yes, the people who passed away are a problem in terms of that's really hard. But from a sociological perspective, that affects everyone in society. If 1 in 10 people die from the flu, then everyone is dealing with something. Everyone is dealing with the loss of friends and family members, and everyone is dealing with uncertainty about what it's going to look like at work. All of those things are sort of really, really important. So I guess that's a brief, very brief history of sort of how we define health. When we talk about mortality, we're talking about what causes people to die. Morbidity is what causes people to get sick. That's in your textbook, and I'm not going to worry about it too much for right now.